Welcome back. Injuries, strains, chronic pain that just will not go away. And that pain can take over every facet of your life. It can really impact people's lives.
And I wrote it on the back.
Oh, you did?
Any father or any parent, no matter where they are or who they are, does not want to see a loved one suffer like this young lady suffers.
One of the most difficult things in the whole world is to watch your child suffer like that and not be able to do anything.
I'm in a constant pain in my entire body. It's usually like a 10 or a 9.
I live in pain every single day of my life.
Our next guest knows all about managing that pain. Joining me today is Tampa Bay pain management doctor who is making a difference in the lives of people who do suffer from chronic pain. Welcome, Dr. Ashraf Hanna from Florida Spine Institute, and guest Andrew Blumenthal and Charles Mattocks as well. Thank you all for joining us today.
Thank you.
Doctor, let's start a little bit with the Florida Spine Institute. What types of pain do you guys typically see in your office and are able to manage?
Well, we treat all pain conditions from back pain, neck pain, hip and knee pain, to a lot of chronic painful conditions like fibromyalgia, chronic regional pain syndrome, Lyme disease. We treat also a lot of various types of neuropathy and many more.
Okay. And as we spoke about earlier, it's really is when you live with chronic pain, it's something that affects every facet of your life, from the moment you wake up until you go to sleep at night. Andrew, tell me a little bit about your story. You're very familiar with living with chronic pain, right?
Unfortunately, I am. I had a back surgery that resulted in chronic regional pain syndrome, CRPS, and I was bedridden and unable to take care of myself or live any sort of normal life.
It takes over your world, doesn't it? Just
Absolutely.
every part of your being.
Yes, ma'am. And I was lucky enough to find Dr. Hanna, and we began IV ketamine therapy.
Okay.
And I've had great results. I'm able to work part-time and trying to reclaim my active life.
Right. And I saw you're up and about a little bit. You still walk with a cane, but you're mobile and your life has definitely gotten better.
Yes, ma'am. I started with a walker, progressed to a cane, and with Dr. Hanna and the physical therapy staff's help, I hope to lose the cane here very soon.
All right. Well, best of luck to you with that as well. Now, Charles, you are kind of coming from pain from a different perspective. You watched somebody deal with pain, and that inspired you to start working on this amazing documentary.
Yeah, my mother. She was diagnosed 8 years ago with CRPS.
Okay.
And I wish we'd have found Dr. Hanna sooner,
Right,
because he is like the Pied Piper of pain.
I like that.
But she's getting treatment now. But you know, the whole thing with the documentary is really to bring awareness. See, a lot of people go years without being diagnosed with CRPS.
Right.
So to try to get the information out there so that it can be diagnosed and also be treated is really the goal of the film. So, you know, I'm seeing her deal with it now, and it's you know, this pain through CRPS is actually worse than amputation or even childbirth. So the importance and the significance of working together with Dr. Hanna and the amazing things that he's able to do is really changing lives.
Now, Dr. Andrew had mentioned something that he underwent, the ketamine treatment. What are typically some of the treatments that you guys work with?
I mean, we offer a lot of treatment modalities, basically from simple acupuncture, physical therapy, to steroid injections, to radiofrequency ablations. And we have top surgeons who perform minimally invasive spine surgery to more complex spine fusion surgery. And because we're able to offer options from A to Z, we're able to customize the treatment for each patient. So we are not limited to only one procedure like laser spine surgery, for example. And one of our common procedures is radiofrequency ablation, or RFA, which I believe is even a little bit better or much better than laser spine surgery, in the sense that it provides the same relief, the same type of treatment, but it's much less invasive. We use much smaller needle, and it's also covered by all insurances.
Now, you have a special therapy that you were talking about too. Is that the one that you were referring to, that one that's a little different than a normal surgery?
Yes, we have been recently using IV ketamine therapy that Andrew and Charles were talking about, and I believe really it's a miracle drug. It had offered green lights to patients who had no hope in the past. It helped a lot of conditions like chronic regional pain syndrome, or CRPS, fibromyalgia, Lyme disease, and a lot of peripheral neuropathy conditions as well.
Some very good treatments going on in there too. We're seeing life-changing right here on this side as well.
Very happy.
Thank you guys both. Good luck with the documentary, and
Thank you,
congratulations on treatment as well.